All right, so welcome again. Thank you for coming to hear about the CHHS International Virtual Summer Program. This is going to be our second year running this sort of style of program that's been created first because of the pandemic, but also now will continue to run programs like this just because it has a lot of benefits and positives. So this coming summer, we're going to run it for 9 days, and I'll talk a little bit about what those dates are going to look like from May into June of 2022. Here's a little bit of what we'll go over. Again, if anything comes up at any specific slide that you want me to stop and elaborate on, or you have a question, please don't hesitate to unmute or put your question in the chat and I will answer it then. We're going to go over a little bit about applications, the different locations that we'll be virtually visiting, what the dates are, our tentative session times. Those are still to be confirmed, but I can give you sort of an idea of what those are going to look like. Different activities that we're going to have involved with the program, how you earn academic credit for this. Not sure if either of you need to earn academic credit for your international experience requirement, but I'll go into that a little bit more. The program fees, which actually you'll find there is no program fee this year. Once you're accepted, we'll have a pre-departure meeting where you can meet all the other students who are on the program and hear a little bit more about the locations. And then we'll have some more time for questions. So I will go ahead and get started because I know it's a beautiful Friday afternoon and I'm sure you want to go start enjoying your weekend. So like I said, we started doing virtual programs during the pandemic because travel wasn't possible, but there are so many different benefits to doing a virtual program. One, it's more affordable, and that being one huge cost is a plane ticket. So you don't have to worry about flying anywhere, and you don't need to worry about getting a passport or anything like that. It's more affordable, especially this program, since it is our second pilot year and we're not having any program fee. We'll be able to visit 4 countries in our little experience, whereas usually you would only visit one unless you went for a semester and maybe did some trips, but typically you'd only get to visit one. So that's a lot of great comparing and contrasting of health and human services to multiple places in the world and comparing them to the US. It can also fit into your schedule. So I'll tell you a little bit more later, but these specific sessions don't take up the whole day. It's just a piece of the day. So you could also potentially take another summer course. You could be working over the summer, doing any clinical or internship opportunities as well. And you get to stay in the comfort of your own home. So you can be learning about food and nutrition on your couch if you wanted to. Students like sometimes are in their bed. So, you know, it's a lot more comfortable than having to physically travel, get the jet lag and all of that. If you haven't been able to and you're interested in applying, the applications are now open on Aztecs Abroad. Aztecs Abroad is our main database of study abroad programs here at SDSU. And this program is called the CHHS Virtual International Experience. There will be a brochure that tells you a little bit about the academics, about the different locations we're visiting. And then there's a tab called application process, as well as overview. And both of those will have a blue apply now button that you can very easily apply to. There's no recommendation letters. It's just a really short paragraph essay about why you're interested in the program, and that's it. So here is a map of the different locations that we're planning to go to. If you notice, Ghana is one of the countries that's listed. We originally were going to be doing South Africa, but because of the time difference, it would have required students to wake up at 6 a.m. And I said that was not something that we were going to be able to do. So we have now moved and are hopefully going to confirm Ghana. We also will be visiting Peru in South America, Japan in Asia, and New Zealand in Oceania. So that's 4 different continents. We are literally spanning the entire world. So we'll get to see a lot of different perspectives on health and human services, as well as talk about what differences and similarities they have to the US. The program dates, the program is going to be set up like this. So you will have sessions Tuesday, Wednesday, Thursday, 3 weeks in a row. So that's if you plan to do long weekend trips. I know it's going to be summer. That way it will make it a little bit more manageable if you have plans on Mondays or Fridays. Week 1 is going to be New Zealand. And for New Zealand sessions, I'll go a little bit more into it on the next slide. But that will be Tuesday, May 24th, 25th, and 26th. Then week 2 will start again Tuesday, May 31st, and June 1st, June 2nd, and then finishing up week 3, Tuesday, June 7th, Wednesday, June 8th, and Thursday, June 9th. Like I said, New Zealand will be week 1, and that will mostly be afternoon sessions. Last summer, we had our session start at 2 p.m. And it was the following day in New Zealand. Japan will be week 2. Usually those are late afternoon, evening because of the time zone. We did our cooking class, I think was the latest session we had, in a karate lesson last year, and they were at 6 p.m. And then Ghana, the times are to be confirmed as well as the location. We're really hoping that this will work, but it would most likely be morning sessions, just given the time difference. And then finishing off the program will be Peru in week 3, and that will be more morning afternoon sessions because it's closer to Pacific time. The actual times, like start and end date times, will be shared closer to when we travel, but most sessions are going to be probably like 2-ish hours, and then we will do a debrief, and we'll talk about what surprised us, what we learned, what we can connect back to the US, and what you might have learned on SDSU's campus or in your clinicals here in the US, and we'll just share our thoughts all together. A couple of the activities and lectures that you can expect or look forward to. Like I said, the probably biggest hit last summer was we did a Japanese cooking class, and we discussed the nutrition and food culture in Japan, and it was actually in the home of a Japanese chef, and she walked us around her house and showed us her garden and different rooms in her house. So we really got to see that Japanese culture. We didn't last year go to Ghana, but hopefully we will get to do that this year. Learn about HIV and AIDS and communicable disease prevention. Also in Japan, we're hoping to, since they have such a large elderly population, hearing about healthcare in the elderly. We'll definitely do some in New Zealand sessions with the Maori, which is their indigenous nation, and hearing about how they provide healthcare for the indigenous communities. We'll also look at medicinal plants and how that's used in traditional medicine in Peru. And we'll have cultural activities that are also woven into each of the locations, as well as some team building. So last year we did a virtual escape the room, which was super fun, and it was sort of traveling around the world at the same time. So hoping to do that again too. So, I see there's a question. Let me pop up. Once the program begins, will we know in advance the times meetings specifically? That may work. That way work schedules can be changed and worked. Absolutely, we will know before the program starts. So I'm still working out all of the logistics with our partners on the ground in each of the countries, but we will know, you'll know at least a month in advance when the times are going to be, so you can plan accordingly. I had last year, students had to come like a little late sometimes, or leave early, and that's perfectly okay. I'm going to try to record as many as I can. But yes, you'll know well in advance so you can plan. So this program is not credit bearing. And if you're in CHHS, or actually if you have an international requirement at all, one of the pieces, the components of international requirements is that you earn academic credit. So in order to earn academic credit, students will enroll in HHS 350, which is an online course offered in fall 2022. And that's how you'll earn the academic credit, as well as, besides just for your international requirement getting credit, it also satisfies explorations B and cultural diversity. So you'll get 3 requirements out of the way with the course. And the course has kind of 2 parts. The first is reflecting on and unpacking your experience. And so other students that maybe weren't on this program, but did some other kind of study abroad experience, like an internship or volunteer program, either virtually or in country, will also be in the class, so you can all share your experiences together. And then the second part of the course is sort of looking at global health issues, how human services are delivered, both abroad and then also in San Diego and along the border region. And like I mentioned, there's no program fee this year because this is kind of our second pilot. We're doing a couple new countries than what we did last year. The only thing that students will have to pay for is if you choose to do the Japanese cooking class, just getting those ingredients, and those will be provided ahead of time. Actually doing the cooking class is not required. It's super fun, but you're not required to do it. And they will also have options for if you have dietary restrictions. So last year we did we made a beef noodle bowl, but there was a vegetarian option. There was a vegan option, and then there was also a gluten-free option. So the woman was able to kind of make changes based on different dietary restrictions. And so before we start the program, but after you've been accepted, we'll have a pre-departure meeting. And this usually takes place in mid-May after you've done your finals and you don't have anything like super pressing academically. This is mostly so that we can all get to know each other, everyone on the program. We do some icebreakers. We learn a little bit about the countries that we're going to be visiting, their cultural norms, so that we know that we're going to be respectful in all of our sessions. We'll also hear a little bit from our partners on the ground, just like logistical things. And then I'll go over more about the daily debriefs, but it's going to be super short. It's like 45 minutes. I'll record it again last year I did 2 separate sessions to try to accommodate all of the students. I think the program will probably be a little bit smaller this year just because there's more opportunity to physically travel. But again, it's not going to be too time intensive. And it's just a nice way for us to sort of bond before we start the program. And that's really it. It's not going to be you don't have a ton of assignments before, and there's actually not even going to be assignments during the program. You're just going to be there to enjoy your experience, and then just focus on what you're learning, and then you'll take the class in the fall where you'll get to apply what you've learned and think about all of the things that you heard and share those out. A lot of the assignments for the fall HHS 350 course are like journal entries, and you're really reflecting on what you learned. I know that was pretty short. That was actually went much quicker than I thought it was going to go. Does anyone have any questions? Or comments or concerns? Okay, here's one. Should we talk to our major advisor about participating in this program, taking the class in the fall if we're doing it to cover the international requirement? You don't need to, because this will cover the international requirement as long as you enroll in HHS 350. So if you are, say, an honor in the honors program, this has been approved as and same with CHHS or any of your majors that have an international requirement. This will satisfy the requirement because you're doing some kind of travel experience, even though it's not in person. The virtual has been approved to count. And then as long as you take the course to earn the academic credit, you will satisfy the international requirement. What is your major? Kinesiology. Perfect. Yes, so this is definitely a great way to, two kinesiology is great. Yeah, this is a great way to satisfy the requirement, especially if you're feeling a little apprehensive to travel still, or if you're really, really busy this summer and don't really have the time to take, 2 weeks or more to go travel. It's a good option because it can fit in with your schedule. It's not as big of a time commitment since it's only a little bit each day. Any other questions? I'll also, actually, you can see actually on a slide, my email's there too. So if anything comes up, if you, even if you decide that you don't want to go for this program, but you want to talk to about other international experiences or study abroad programs, you can always come talk to me about summer options, winter options, semester options. I work with a lot of kinesiology students, so happy to help in any way that I can.